Welcome. Today I'm going to talk about the root cause of trigeminal neuralgia, or TN, a painful facial neurological condition that can be extremely debilitating and destructive to people's lives, and the most effective holistic home remedies versus conventional medications and surgeries to manage your pain in the comfort of your home, and ways to prevent this terrifying pain, which is considered the worst pain of humankind. My name is Dr. Maryam Horiyat, a biological dentist at Aria Dental, where we exclusively provide various holistic dental services with the support of our dedicated board-certified specialists for all ages in South Orange County of California. Have you been diagnosed with trigeminal neuralgia? Are you suffering from daily facial pain like electrical shock, stabbing pain, or chronic constant aching pain in your face? Have you been put on strong medication with significant side effects to manage your facial pain? Have you been told that you need surgery to relieve your intense facial pain? Remember, you are not alone. More than 200,000 people are diagnosed with trigeminal neuralgia, and many are left undiagnosed or misdiagnosed in the United States every year, including many of my patients who motivated me to make this video. So watch this video to the end for a holistic perspective and look for the root cause of your facial pain. However, just remember, the information in this video is not a cure. It is simply a way to help you manage your pain in a very holistic and non-toxic way in the comfort of your home. Let's dive in. What is trigeminal neuralgia, triggering such an unbearable chronic facial pain, and what causes it? Trigeminal neuralgia is a type of neuropathic pain that affects the distribution of one or more trigeminal nerve, also known as a fifth cranial nerve, is located on both sides of the head, starting at the lower part of the brain and extending throughout the face. The trigeminal nerve splits into three main branches near the top of the ear. These branches are the ophthalmic, the maxillary, and the mandibular branches. The ophthalmic branch provides sensory to many parts of the face and skull, including the eye, forehead, upper eyelid, and nasal cavity. The maxillary primary function is a sensory source to the mid-third of the face. The mandibular branch provides sensation to the jawline, chin, lower lip, cheek, teeth, gum, oral mucosa, temporomandibular jaw joint or TMJ, the ear, and the skin of temporal region. The mandibular branch also provides motor function, which controls all muscles of mastication or chewing muscles. In trigeminal neuralgia, neuropathy or nerve damage occurs because of demyelination or chronic loss of myelin sheath, an insulating layer made of protein and fatty substances covering trigeminal nerve cells. Trigeminal nerve demyelination leads to irregular conduction of signals and electrical impulses that are then perceived as characteristic pain. There are three types of trigeminal neuralgia. 1. The classical, where there is a compression of trigeminal nerve root by unusual vascular loop, most commonly the superior cerebral artery. 2. The secondary is caused by another pathological process such as multiple sclerosis or a tumor. 3. Idiopathic, where no clear cause is identified. Of course, there is another category that has not been focused by conventional medicine and pharmaceuticals, and that is inflammation and toxicity from our nutrition, environment, medicines, and dental materials, which can create any type of neuropathy or nerve damage to trigeminal nerve. Signs and symptoms of trigeminal neuralgia. Pain is the primary symptoms of trigeminal neuralgia. The pain itself is divided into two types: type 1 or classic pain, type 2 or atypical pain. Type 1 or classic pain is described as a sudden, shooting, sharp, stabbing, or electrical shock character that is extremely intense and lasts for seconds to minutes. It can happen 1 or 2 times a day, up to 200 times a day, and repeat itself every day. Type 2 or atypical pain shows more constant burning or aching that's usually less severe or intense than type 1. Generally, the pain occurs only on one side of the face. Only 3% of people experience pain on both sides of their face. Pain can be frequent, such as episodic, occurring years apart, or it can happen many times in a single day. Pain is generally unendurable and drives individuals to mental health conditions, including depressions and self-destructive inclination. Diagnosis. How does it get diagnosis? Trigeminal neuralgia is a clinical diagnosis. You cannot make diagnosis with a blood test, MRI, or CAT scan. It is a condition in which the patient presents with a characteristic pain. However, sometimes MRI, CT scan, or regular X-rays may be required to rule out other pathologies like MS, tumors, strokes, abnormal blood vessel loops, TMJ disorder, hidden jawbone infections like osteomyelitis or osteonecrosis, and even root canal tooth or tooth infections. What are the risk factors? In looking for the root cause of trigeminal neuralgia, I read numerous papers, and my conclusion was trigeminal neuralgia is affected and triggered by nerve damage or neuropathy to trigeminal nerve by common risk factors, including but not limited to the following. 1. Nerve toxicity. 2. Physical trauma. 3. Chronic inflammation. 4. Nerve infections. 5. Tumors and cancers. 6. Blood flow abnormalities and hypertension or high blood pressure. Remember, this is not in any specific order. Let's get into more detail. What causes nerve toxicity that could lead to neuropathy or trigeminal neuralgia? 1. Neurotoxic metals such as mercury, aluminum, cadmium, chromium, nickel, and copper, commonly found in dental materials such as amalgam fillings or silver fillings, metal crowns, and titanium dental implants, are well-known toxic materials in dentistry that can cause trigeminal neuralgia. 2. Certain antibiotics, chemotherapies, many cardiac medication used for epilepsy, tumor necrosis factors or TNF, antiviral medications, and excess vitamin B6 are well-known neurotoxins. Common physical traumas associated with neuropathy and trigeminal neuralgia are 1. Dental procedures such as traumatic tooth extraction, dry socket, and root canal teeth could lead to a hidden jawbone cavitation known as neuralgia-inducing cavitational necrosis or NICO. 2. TMJ disorder or malocclusion, imbalanced bite, clenching and grinding or bruxism could damage the surrounding facial muscles and trigeminal nerve. 3. Airways issues such as sleep apnea and mouth breathing could trigger clenching and grinding during sleep and ultimately triggers trigeminal neuralgia. 4. Previous facial surgeries, including cosmetic facial surgeries. 5. Sport-related trauma, car accidents, physical fight trauma, and more. Common chronic inflammation and autoimmune diseases that are directly linked to a higher risk factors for causing facial nerve neuropathy of trigeminal neuralgia are 1. Silent diseases with no obvious pain of chronic gum inflammation or gingivitis and gum disease or periodontitis. 2. Autoimmune diseases such as multiple sclerosis or MS are well known to be affected by toxic metals such as lead, aluminum, and mercury, commonly found in dental materials, increase the risk of trigeminal neuralgia. 3. Chronic inflammation by metabolic syndromes such as diabetes and obesity. 4. RF, EMF, radio frequency electromagnetic fields simply emitted from your cell phone can increase chronic inflammation and lead to trigeminal neuralgia. 5. Gender. Females are at higher risk of chronic inflammation and autoimmune disease than men, so they are at higher risk of trigeminal neuralgia as well. 6. Smoking is another cause of nerve inflammation and toxicity. 7. Diet and nutrition. Saturated fat, vitamin B12 deficiency and other vitamin B complex, magnesium deficiency, excess omega-6, high sugar diet, high potassium increases nerve inflammation and neuropathy. Common microbes that could affect neuropathy in trigeminal neuralgia are 1. Viral infections such as herpes virus in simple cold sores, shingles, Epstein-Barr, and cytomegalic viruses that live in the ganglion or nerve bundle where the trigeminal nerve originates from. 2. Bacterial infections such as meningitis or oral bacteria found in the dental plaque, gingivitis, periodontitis, infected tooth, or root canal teeth. Blood flow to the brain and hypertension. Any abnormalities that cause trigeminal nerve root compression may lead to trigeminal neuralgia. Common factors are 1. Aneurysm, 2. High blood pressure or hypertension and arterial tuberosity, 3. Regional tumors such as posterior fossa tumors. What are the treatment options for trigeminal neuralgia? The main goal of conventional medical treatment is pain relief with either medications or surgeries. The first line of treatment option is anticonvulsant or anti-seizure medications such as carbamazepine. Gabapentin is considered a second-line agent, less effective than carbamazepine. The more traditional medications such as Advils, Motrins, ibuprofen, and other opioids are not usually helpful in treating trigeminal neuralgia. In conventional medicine, if medical therapy fails, then surgery is usually recommended. I'm not going to get into the detail of the surgeries, but the most common surgeries are 1. Microvascular decompression, 2. Radiofrequency ablative procedures such as stereotactic surgery and gamma knife radiosurgery, 3. Balloon decompression. Now let's talk about holistic, natural way and non-toxic way to help with this pain of trigeminal neuralgia. The best and most effective holistic approach is to find the root cause and reduce the risk factors for neuropathy and chronic loss of trigeminal nerve myelin sheath and nerve inflammation. Some dental and nutritional recommendations are 1. Get a consultation with a smart, certified biological dentist to safely remove any metals in your existing dental materials, mainly your amalgam or silver filling that contain more than 50% mercury, a well-known neurotoxin, or metal crowns such as PFM or porcelain fused to metal with hidden metal mixtures under your porcelain. Then, take a very holistic chelation approach for detoxification from any previous exposure to these metals. A proper heavy metal test is strongly recommended. 2. Ozone therapy and ozone injections have helped many of my patients drastically to manage their pain by reducing inflammation and increasing blood flow to the trigeminal nerve and healing process of trigeminal neuropathy. 3. Many different dental laser treatments with biostimulation properties have been very effective for pain management for many of my patients. 4. To get evaluated by a true biological and holistic dentist for replacement of your infected root canal teeth that are considered dead or decomposing teeth that accumulate harmful bacteria. 5. Get evaluated by an expert biological dentist for possible hidden jawbone cavitation or NICO in the areas of previous extractions such as wisdom teeth extractions or existing root canal teeth. 6. Maintain good home care, oral hygiene, as well as frequent professional appointment with hygienists who uses ozone therapy and laser treatment to properly reduce plaque and harmful bacteria in a natural and non-toxic way. 7. Avoid fluoride treatment in your toothpaste or any dental materials such as certain cements, sealants, or during your dental hygiene appointment. 8. Make sure your dentist does not use any products containing BPA or bisphenol A and HEMA or hydroxymethacrylate, mainly found in many dental bonds, composite filling, or dental cements. 9. Avoid taking unnecessary medications such as antibiotics like Cipro or Levacoin that could cause neuropathy of trigeminal nerve. Unfortunately, antibiotics are overprescribed by dentists in the United States, so be careful. 10. Adequate vitamin B12 or any other B complex, magnesium, and omega-3 fatty acids are necessary for maintaining the health of nerve cells, including trigeminal nerve. 11. Acetylcarnitine increases the activity of certain nerve cells and supports nerve function and blood flow of trigeminal nerve cells, so make sure you do not have a shortage of it. 12. Avoid certain foods such as caffeine and citrus that can trigger pain related to trigeminal neuralgia. 13. Avoid foods with high potassium such as bananas that potentially may trigger facial pain in trigeminal neuralgia. 14. Avoid processed foods, seed oils, corn oils, soy oils, that contain high omega-6, which has a very high pro-inflammatory effect and cause oxidative stress and insulin resistance, therefore nerve cell damage and inflammation. 15. Avoid excessive alcohol consumption. 16. Luteolin, which is a natural substance in many different foods like broccoli and kale, has a very powerful neuroprotective anti-inflammatory and antioxidant effect which can help with many neurodegenerative diseases and neuropathic nerve pain, including trigeminal neuralgia. Remember, this information is not a cure. It is simply ways without side effects to reduce episodes of trigeminal neuralgia and manage your pain in the comfort of your home. I hope you find this video very helpful. Please like us below and subscribe to our healthy, holistic oral health videos. A healthier mouth means a healthier life, ultimately means a happier life.